In today's video, I'm going to show you how you can strengthen the muscles of your foot. I'm also going to talk about why it's important and what conditions would benefit from strengthening the foot. The foot is an extremely complex structure and it's made up of a number of bones and joints, and that allows the foot to be flexible and act as a shock absorber when making contact with the ground, but it also relies on muscular contraction to create stiffness in the foot so that you can have an efficient walking or running motion. If the muscles of the foot aren't strong enough to create a stiff, stable foot, what ends up happening is that other tissues compensate, but over time, having those tissues absorbing the additional load or compensating for those weak muscles, that's going to lead to tissue injury down the line. And one of the most common foot and ankle complaints that we see in the clinic is a condition called plantar fasciitis. So today I'm going to discuss how weak foot muscles can predispose someone to developing plantar fasciitis. As musculoskeletal clinicians, we were very quick to blame a flat arch as one of the main causes of plantar fasciitis. However, there's been some research that shows that isn't the case. One of the studies that I referenced when writing the blog for this video found that there was a low correlation between low arch height and the development of plantar fasciitis. So dorsiflexion of the toes is this motion here when the toe bends upwards. So naturally your toes are going to dorsiflex when you toe off from the ground. So what muscles control dorsiflexion? It's the toe flexors on the underside of the foot. Now these muscles essentially would be actively lengthening while the toes dorsiflex, so they'll be decelerating the toe, or they'll be limiting that motion. So weakness in those toe flexors is going to allow for increased rate of dorsiflexion, and that, the authors found, was a bigger predictability of plantar fasciitis. There's another study that I've referenced in the blog, and they took roughly 200 individuals with plantar heel pain, and they compared their feet to about 70 normal people who didn't have any foot or ankle pain. They wanted to find out what the physical differences were between the group with heel pain and the group without heel pain. So of all the physical factors that they tested, they looked at things like body mass index, foot and ankle flexibility, muscle strength in the lower limb, somebody's body mass index, how long they spent standing on their feet, and of all those different findings, they found that the three biggest differences between the group with heel pain and without heel pain was reduced or weakened toe flexor muscles, weakness of the peroneal muscles, which are a group of muscles that run on the side of the shin and run under the foot, and thirdly was reduced ankle dorsiflexion range of motion. So for this video, I'm just going to be discussing how to strengthen the toe flexors and the peroneal muscles of the foot, as these two muscles, or weakness in these two muscles, was shown to be a predictor of plantar fasciitis. Now I'm going to show you some exercises that you can do to help improve the strength of your feet. You might have come across exercises such as the short foot exercises, or picking up marbles, or towel curls, even some TheraBand exercises. Now the problem with these exercises is that they strengthen the muscles of the foot in their shortened position. But now when we're walking, those muscles that are on the underside of the foot need to be strengthened in their lengthened position, because that's when they're exerting the highest amount of force. So training a muscle in its shortened position doesn't carry over well functionally into tasks that we do every day, like walking or running. So what we're doing over here, we're going to do a paper grip test. So what that does, that tests the strength of the toe flexors and the peroneal muscles. So it looks at all the toe, basically all the intrinsic muscles of the foot, and it tests them together to give us a score. So the way we do that is we use a little force dynamometer, and it's got a almost like a business card size hard piece of plastic on it. So what we're going to do is basically what we do, instruct the patient. You're going to keep your hips at 90, knees at 90, hands on your hips, so we keep it nice and standardized. He's going to keep his heel flat on the floor. He's not allowed to lift it up when we do this test. So what we're going to do, just position the card under your big toe, 0 the force meter. Okay, so you're going to push your big toe down as hard as you can. I'm going to try to pull this away. Push, 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 push. Nice one. So that's 8.46, and we repeat that test 3 times, and this will give us the maximum score. Go again, push, 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 push. Nice one, that's a bit better. Cool, push down again. Push, 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 hard as you can. Awesome, actually really good. Cool, so you can see there, he got 10.8 under your big toe. How much do you weigh?
102.
Okay, so that's pretty close to 10%. So under the big toe, we want to aim for about 10% of your body weight is how much force we want to see generated under that toe. So now we're going to test the smaller 4 toes together. So we're going to zero that again, flip the card around. Cool, so you hold down, same again, push down as hard as you can, keep the heel flat. Cool, 8.64, that's good. Push, sorry, let's get the right end, go again. Push as hard as you can. Cool, last one, push as hard as you can. Last one, and you got 9.98 underneath the smaller toes, and that's well within that that 7 to 8% of body weight is what we're looking for generated by the smaller toes.
Okay.
Thank you. Cool. In the clinic, we use a device called a toe pro. Now, what this is a foam structure, and it's got specifically designed angulations and ridges. What that does is it places the toe flexor muscles as well as the peroneal muscles on a lengthened position when they contract. And again, that carries over well into functional tasks like walking or running. If you don't have one of these toe pro devices, you can also do these exercises using a rolled up foam yoga mat. Now, it may not be as effective as the toe pro, but it may still help, and it might be a good start and help you gradually improve your foot strength. This is the first exercise. The way you do this is position the toe pro close to a wall with your toes just over the top ridge. Notice my toes pressing down hard now and my ankles bending, dorsiflexing. What that motion does, that simulates the position that the toe flexor muscles are going to be in and the weight they're going to have to be dealing with while walking or running. This is the same test, just performed on a rolled up yoga mat. So you can see I've rolled it so that just my toes are up over the edge of the mat and the rest of my foot is on the floor. And it's the same action again. Start by driving the toes down hard as you can and then letting your body approach the wall while maintaining that toe flexion. To do the next exercise, you're going to position your foot so that your toes are over the top ridge of the toe pro device. You're going to do the same motion again. Start by driving the toes down hard into the mat and then pressing up into a calf raise, holding there for 3 seconds and lowering down slowly. And again, drive the toes down hard into the mat, press up into a calf raise, hold there for 3 seconds and lower it down slowly again. So here's that same test again with a rolled up yoga mat. So again, I position my foot up over the mat, so just the rear half of my foot and my heel is on the floor. So again, same motion. You're going to start the motion by pressing the toes down hard into the mat and then pressing up into a calf raise, holding there for 3 seconds and lowering down slowly. This next variation, you're going to have the outside of your foot positioned on the downward slope of the toe pro device. The way you do this one, you're going to drive your big toe down hard into the mat, press up into a calf raise and come down slowly. Again, drive the big toe down, press the toes in, lift the foot up, hold, and then lower down slowly again. This exercise targets the peroneal muscle, specifically a muscle called the peroneus longus, because when your foot is on the bottom in that starting position, it's rolled inwards and that places those muscles on a lengthened position. So here's the variation of that exercise just on the rolled yoga mat. Now this gets quite tricky. You can see with my other foot what I was doing is trying to hold the mat down. You could probably get more creative with it, but the principle is the same. You want to have the rolled mat so that your big toe is slightly raised and that the outside of your foot is on the downward slope. And again, same action. You're going to drive the toes down hard into the mat, press up into that calf raise, and come down slowly again, and repeat that. For this variation of the exercise, what I've done is just swap feet around for the video, but the principle is the same. My foot is now facing, or my big toe is now facing down the ramp. So what that's doing, that's placing the long toe flexor muscles, the flexor digitorum longus and the flexor hallucis longus. It's now placing those muscles in their lengthened position. So again, what we're going to do, we're going to drive the toes down hard into the mat, press up into a calf raise, and then lower back down slowly, and repeat. And here's the same exercise again using the yoga mat. So again, you can see how my small toes, or my outer toes, are angulate upwards on the rolled up mat, and my big toe is facing down the ramp. Again, it's a bit tricky to balance on this one, but it can be done. So again, drive the toes down hard into the mat, press the heel up, hold there, and then lower back down slowly. Thanks for watching. I hope you found this video useful, and I'll see you again in the next one.